Hello, and welcome to part one of our two-part series on disparities in chronic kidney disease. My name is Dr. Julia Iyasere. I'm the Executive Director of the Dalio Center for Health Justice at New York-Presbyterian, and I am joined by David Wyman, President of Rogosin Institute. Together, we are extremely proud to co-sponsor today's event and are thrilled to be joined by such esteemed panelists. The Dalio Center for Health Justice just celebrated its one-year anniversary earlier this week. And as with all anniversaries, it provided a moment of reflection and for rededication. Our founding mission was and remains to be a leader in the identification and elimination of health inequities, but with a focus on the systemic and the structural factors that lead to the conditions of poor health. We are steadfastly committed to this mission and are achieving it by leveraging data, supporting research, developing and informing our clinical and community programs, and as we are today, by elevating salient topics in the field through education. Numerous authors have commented on the rising racial and ethnic disparities in chronic kidney disease, highlighting some of the complex factors, both medical and social, that have led to the elevated risks that we see, particularly in Black and Brown communities. Dr. J.D. Tucker noted that the social determinants of health, race and racism, are equally, if not more important, in explaining the excess risks of kidney disease in African Americans relative to their white counterparts. He notes that access and advocacy will help, but systemic change is needed to meaningfully improve outcomes. The first step towards change is awareness, but meaningful change requires education, commitment, and focus. I am honored to learn from our three phenomenal speakers, Drs. Mohan, Saul, and Webb, who are helping not only to elevate the dialogue, but are inspiring action towards improving the health and well-being of our patients and our communities. I'll now pass it over to David Wyman to make additional opening remarks.
Good afternoon. Thank you, Julia. I am honored and so pleased to welcome all of you to today's, what is Rogosin's 10th annual symposium. We are so pleased to be partnering with the Dalio Center to discuss important topics, which will focus on aspects of social and health disparities and its effects on kidney health. And importantly, opportunities to improve its future prognosis. We have a wonderful and esteemed lineup of physicians to walk us through, and I want to thank Doctors Saul, Mohan, and Webb for joining us today. Rogosin's very own Dr. Saul will be leading this off. And I want to thank all of you for joining us today. We have over 485 registrants joining us to educate themselves so that we can all impact the future of this important discussion. As Julia indicated, please do stay tuned for part two, which will take place on November 17th. And with that, I will turn this over to Jeffrey Silberzweig, who will be our moderator for today's event. Thank you.
Good afternoon. Thank you, David. It's a pleasure to have everyone here. And we just have a few housekeeping items that we want to go through before we actually kick the symposium off. So first, there is no conflict of interest for any of our presenters today. At the end of all of the presentations, a presenter and CME code slide will be displayed. In order to get the CME credits, you have to include these codes on your evaluation, so please stay tuned for that. And you should have received an evaluation form in your registration materials for today. All questions will be answered during the Q&A panel session at the end. Please do submit your questions by clicking on the Q&A button on the bottom of your screen and typing in the question. Note that only the host and the panelists will be able to see the questions, not the entire audience. If you're having any audio issues and need to rejoin the symposium by phone, please call 212-225-8997. If you need additional technical support, Rogosin's IT team is available for assistance. Please call them at 646-317-08 For any other questions regarding today's event, please email tah9063@nyp.org. So with that, I want to just give a brief intro to our goals today. So we have 3 wonderful speakers, as you've heard. Our goal is to really talk about, to quote from Dr. Cameron Webb, who you'll hear shortly, our goal is to move from aspiration to action. There's been a lot of talk about how we might address inequities in the healthcare system, and specifically in chronic kidney disease. And today we're going to talk about some actions that some have started to take and some actions that will be taken to help us address those disparities.